In Ghana, hospitals in Accra, Techiman and Peki are embracing renewable energy to transform healthcare delivery. Through our solar energy, these institutions are not only ensuring reliable power, but also contributing to a sustainable future. The installation of solar PV systems in Korle-Bu, Holy Family and Peki Government Hospitals is part of a broader effort to enhance energy security and improve healthcare outcomes in Ghana. These installations help power essential healthcare services while reducing carbon emissions. Solar PV systems now provide reliable, clean energy to these hospitals, ensuring that life-saving equipment can function without interruption. The systems also offer energy security in a country where power outages can disrupt critical services.
Power is one of the necessary ingredients that we need to deliver our services to patients in the Korle-Bu Teaching Hospital. And prior to the installation of the solar system, anytime there was a power outage from the national grid, it affected work at the administration. But with the installation of this solar power system, we've seen a major improvement in power stability.
After the intervention of GIZ and then the installation of the solar panels, in fact, I would say that our electricity bills, I would say the costs have reduced drastically. Last month, that is September bill, we've paid about 245,000 Ghana cedis as compared to 240,000 Ghana cedis. I think that is a great relief. And this, I would say, will help the hospital in doing a lot of savings.
Before the intervention, the hospital uses a lot of equipment which are energy-based, and we use electricity from the national grid. And some time passed, the electricity bills were piling, though we're paying a little to government on it, but it was piling. And then we even have a demand notice from ECG that they will come and cut us our power off. So we were in a dire need of a stable electricity. And we are also, those days where we don't know when they will come and be asking for their money. And then the power situation too, it fluctuates. Sometimes the voltage is not good and then the power goes off. You have to go and switch on generator. And generator uses diesel. That is giving emission to the environment. And if the voltage is not good, it also doesn't help the equipment.
With this system, I think it has really bring a difference, because without electricity, we can't do anything. Now, what we intend doing to sustain it is that we'll do regular cleaning of the panels as and when it demands. And we also take good care of the equipment, that's by regular blowing of the dust so that it can maximize its efficiency.
From its humble inception as a 192-bed capacity hospital, Korle-Bu has now evolved into a 2,000-bed tertiary healthcare facility. It is the biggest hospital in West Africa and the third largest on the African continent. Korle-Bu is now the leading national referral center in Ghana. Empowering women in the energy and healthcare sectors is a key component of this initiative. Women are playing critical roles from managing the hospitals to installing and maintaining the solar systems, contributing to gender equality in traditionally male-dominated fields.
Before the intervention of the GIZ, the project, we were having a lot of power failures in the facility, and our consumption was high in the facility. So if we look at in May, that was before the installation of the solar system, the consumption was 108,000 kilowatt hour. And then after the installation, that is in September, we recorded 71,000 kilowatt hour. And with the solar augmenting with the ECG, it has really helped us to really sustain and really give quality healthcare to our clients.
Electricity is very vital to our work now. And first, when we were only on ECG, you can be attending to a client, then the power will be fluctuating. It comes off. And now that the solar has come, it has helped to stabilize the system for us, so everything moves smoothly. And in addition to that, it helps the hospital to also save money financially, which helps to improve things in the hospital.
The GIZ solar project on the hospital has really been impactful, because one of the worries that we have is the power outages. Unfortunately, we don't know when it will go off. So it's worrying that you're in the middle of work and then power is off, equipment is off, clinical work will have to stop. But with this GIZ solar project, we have 24/7. So that worry is not there. We know that 24/7 we have power to support our equipment, to also improve quality of work. So with such projects that we get 24/7 power to support equipment, because this maternal and newborn, it depends heavily on equipment. In effect, improve quality of care and then improve good health for mother and child.
Such impactful intervention by the GIZ and the German government contributes to helping Ghana to achieve the Sustainable Development Goal 3, which is good health and well-being. SDG Goal 7, affordable and clean energy. And then SGD number 13, that is climate action. And then when we get support, additional support from our partners to roll out such interventions across the hospital and also in other health facilities spread across the country. So we want to use this opportunity to express our heartfelt appreciation to the German government and the GIZ for bringing this project to Korle-Bu Teaching Hospital. Thank you once again. You have been a good partner. We hope this opens the way for more collaboration between the hospital, the German government, and then GIZ.
The solar PV systems have had a direct impact on healthcare delivery, ensuring that life-saving machines and medical devices operate without interruption. This also contributes to a significant reduction in energy costs and helps the hospitals reduce their carbon footprint, all while improving patient care. This intervention not only enhances the quality of care, but also strengthens the local healthcare system, benefiting communities at large and supporting the global effort towards achieving the Sustainable Development Goals. From unreliable power to a stable, clean energy supply, the transformation of these hospitals is setting a new standard for healthcare and sustainability in Ghana.
We appreciate very much the role of the German government through the Ministry of Energy and then GIZ for bringing this good intervention
We say a big thank you to the German government and the GIZ for bringing this project to Peki Government Hospital. It has really improved our work, and we are grateful for that. We ask that they should please bring us much more of this project. God richly bless them. We really appreciate it.
We want to thank once again the German government. We also want to thank GIZ for giving us this important project. We are saying that we are one of the few people that have benefited from this project, especially under the CHAG, Christian Health Association of Ghana. We thank them so much.
Thank you, GIZ.
With clean energy powering essential healthcare services, Ghana's hospitals are not only improving patient outcomes, but also leading the way toward a sustainable future. This project shows that the future of healthcare is also the future of energy.